Glenn, you know, visiting the doctor, it's a very important part of staying healthy, but there's a chance that people aren't always taking full advantage of their one-on-one time with their care providers. Well, here to help share some helpful tips and make the most of your doctor's visit is Healthcare Partners physician, my doctor, Dr. Justin Maxwell. How are you, buddy?
Good to see you.
It's funny, we have an appointment in about a month, but I think this is a checkup. It's an early checkup.
That's right.
When people get in front of the doctor, it's not just a chance to sit down and, all right, fire at me, doc. You should be asking questions too. How do we make the most of our trip to the doctor?
Great question. It's very important that patients provide their physicians with a very detailed history, specifically family history. It's very important for us to know if there's any cancers in the family, diabetes, heart issues, stroke. And you also want to make sure you're very honest with your physician. When we ask you questions about, say, illicit drug use, marijuana, don't be shy. It's confidential, but it's very important for us to have that information. Make sure you're early to your doctor appointment. Yeah. Sometimes for me, if I finish early with a patient, I will bring the next patient back and they may actually get more time spent to address their concerns. Sometimes patients will bring in a list of about 15 medical problems, and we do have a certain given time slot. Yeah. So choose about 2 or 3 of the most pressing issues so we can allot that time to handle those issues, and then you can always schedule an appointment after or a follow-up visit for that. And last is medications. It's very common where we will send patients out to see specialists and they'll change the medications. So patients should have their medication list, bring their medicines in for us to discuss.
To have a full repertoire, knowing what it is. By the way, if you show up early, you get to watch us. We're on their screen all the time.
That's correct.
Yeah. And then the waiting lobby is crazy. I know there are different screenings and different exams for different age groups that are recommended. Is this something that a patient should discuss with the doctor? Is it something the doctor would just know?
It is. Patients should be proactive in terms of that. We do have various screenings, screening mammograms, colonoscopies for colon cancer, prostate screening, vaccinations, pneumonia shots, shingle shots, and we have different age parameters or screening guidelines for that. And that's why it's very important that patients tell us their family history. For example, we normally screen for colonoscopies at age 50. But if you had a first-degree relative, and say they had colon cancer at 53, we would screen you 10 years prior. We would start you at 43. Oh, wow. And that's why that's important.
It's very important. What about after hours? If you need care after hours or need, let's say, a prescription refilled, how do we get that?
Healthcare Partners actually has what's called a PAL line. It's a patient access line. So when we're out of the clinic, if it's holidays or weekends, we have registered nurses that can field medical questions. If patients need refills on medications or if they need to reschedule appointments, that is available.
That's very important. Yes. I've gotten these calls before. The Televox system. What's the Televox system, and how does it keep us on schedule?
The Televox system, think of it as a courtesy reminder of your appointment so you're on time.
Okay, let's talk about Healthcare Partners then. And the great job that you do, you have this thing called the total care model. You said that you can send people out to specialists, and I know within Healthcare Partners, the specialists are often under the Healthcare Partners umbrella.
Correct.
And you're all using the same system, so you know you're all on the same game plan, right?
Yes.
Explain the total care model for those who have not been a part of it.
The total care model is a unique model where we have physicians, we have nurse practitioners, we have specialists, case managers that really work diligently to coordinate the highest quality healthcare here in Southern Nevada. I like to think of it as the VIP medicine without the high costs associated with it. And it keeps everything kind of under an umbrella, so we're not doing a lot of redundancy with medical tests such as MRIs, CAT scans. Our efficiency is better.
We've been there. We have to fill out the same form at every place, the same scans, the same x-rays. And it's like, why am I doing this a 5th time?
Absolutely.
It's very expensive. So you get rid of the unnecessary redos.
Absolutely.
That's awesome. There are a lot of different Healthcare Partners locations. How do we find one near us, and if we want to possibly have you as our doctor, say?
Best way is to visit our website at www.hcpnv.com, where you can find the various locations and schedule appointments today.
And I know you're at one of the newest locations in the Valley, right?
That is correct. I'm at the Fort Apache and Tropicana location.
It is a fancy location, let me tell you. It's all decked out. Nice people as well. And trust me, I hate going to the doctor. Who likes going to the doctor? But he makes it fairly nice. Doctor, great having you. See you in a month.
You got it.
Hopefully my blood pressure's down. Next time you visit your doctor, be ready to talk. Don't be afraid to discuss your background and lifestyle. For more information about healthcare partners and to find the clinic nearest you, visit hcpnv.com. They're also on Facebook and Twitter. Dow, over to you.